Hi, I'm Brittany Montez, and this is the Orlando Health News Review for January 9th. We're here at the Orlando Health Freestanding Emergency Department and Medical Pavilion at Horizon West, and we're here to tell you why this place is so special.
We're actually a freestanding, fully functional emergency department that also offers outpatient services. As a local community member, it's really neat. I can get a prescription from my provider and bring it actually right here to get lab work and imaging completed.
We have the benefit here that we're able to direct bed all of the EMS patients, so they're either given a room number on the radio when they call in, or they're given as soon as they walk through the door. So the report is given to the provider as well as the nursing staff typically as soon as they arrive into the room, into the hospital. We do have a fully functioning helipad out back, so there is that option for patients if they come in that need to be transported in an expedient manner to get them downtown or to any other facility.
With the shared space and just being within walking distance, really it's better to just get up and go walk over there than even pick up the phone and call. So that's really nice. Obviously, we're all on a first name basis here. When the patients are here, we're all saying, hey, what can we do to make sure that our patients are being taken care of? I think everyone comes to work with a, how can I help mentality? And I think that's kind of a shared personality between all of us. And so I really, really appreciate our team here.
Speaking of freestanding emergency departments, patients in Osceola County now have a brand new facility for outpatient care, with several services being offered in one centralized location. The new Orlando Health Emergency Room and Medical Pavilion Osceola in Kissimmee is serving the growing Osceola County population. This $48 million investment signals an increasing footprint for our organization and is one of 5 similar facilities Orlando Health established in other communities.
In November of this year, we celebrated 100 years at Orlando Health. And while a lot has changed about Orlando Health, the buildings, the name, the technologies, what's not changed is the spirit and the desire for excellence of our team members. And I am excited that is coming to this community. That will raise the bar of the care provided in this community. And so thank you for doing this.
Osceola County is the second fastest growing county in the state of Florida. And so this allows us to continue to expand our footprint, but in a way where we continue to meet the needs of the growing community. We have a lot of team members that live in Osceola County and live close by, so I think this is a great opportunity to expand your career closer to home. This site will actually function as a department of Dr. P. Phillips Hospital. So most of the patients that we come here, we hope to be able to treat right here in this facility, but any patients who require transfer to a higher level of care, we'll transport up to Dr. Phillips and leverage our capabilities up there. And then any patients that really need trauma care or anything more advanced will be transferred to ORMC or Arnold Palmer Hospital.
And recently, Orlando Health Central Hospital hosted a 1-year celebration for their robotics program.
With the robotic surgery, you now can do these procedures with even small incisions and reach areas in the abdomen that will be more difficult laparoscopically. And as a result, the patient, the length of stay is much shorter, and post-op pain is much improved, and it just adds to the overall Orlando Health experience.
Congratulations to the team for this great achievement. And last weekend, Orlando Health partnered with Major League Soccer to put on the 2019 Major League Soccer Medical Symposium. Collegiate and professional soccer leagues rely on the medical teams to treat soccer-related injuries and return injured players to the sport in a safe and efficient manner. This symposium provided medical teams with guidance on identification, prevention, and treatment of injuries and illness common to the soccer athlete.
What we've done is bring together the medical teams from all of the Major League Soccer teams across the U.S. and Canada, and they have come down here today to present to athletic trainers, physical therapists, occupational therapists, physician assistants, physicians, nurses, to talk about the focus of soccer medicine. We don't just do the basic standard of what we can do, we actually elevate it and take that to the next level of what it means to care for professional athletes.
There's a great lineup of speakers from all around the country, as well as some of our own Orlando Health physicians and staff who are giving talks as well. We've had an ultrasound conference this morning where we looked at musculoskeletal ultrasound as a diagnostic tool for sports injuries. There will be talks on cardiovascular concerns and controversies, talks on sports science and nutrition. So performance is important for us as well, not just getting injured players better. We want to make sure that we get them performing as well as they can on the field. For Orlando Health, it's a privilege to be able to partner with a group like Major League Soccer, and it definitely shows that we are providing care at the highest level in the United States.
And for this week's Hot Fact, did you know that since December 20th, 2017, around 450 patients have been served at Orlando Health Central Hospital with the Da Vinci robot? According to the company that makes the Da Vinci robot, for most hospitals this size, it takes 3 or more years to achieve this amount of cases. Well, that's it for today's edition of the Orlando Health News Review. Thank you for making Orlando Health the best hospital possible. See you next week.